So today we're talking about artificial colostrum for calves. There are two main types that we can talk about. Either we talk about it as a colostrum supplement or a colostrum replacer. So when we talk about a colostrum supplement, that is a colostrum that we're feeding to calves that have maybe had some colostrum from their mother but are just needing a bit of a top up because their mother's colostrum is not maybe at the right level of immunoglobulins within it. Whereas a colostrum replacer is typically replacing the dam's colostrum completely. One of the most crucial aspects of colostrum is the level of immunoglobulins. So if you have got the mother's colostrum, we can measure to see how many immunoglobulins are within the colostrum, whereas when you're looking at a colostrum powder, they typically have a set level of immunoglobulins in there that will be hitting the right amount for the calf. The reason immunoglobulins are important is this is the passive transfer of antibodies into the calf and setting up their immune system for life. When to feed artificial colostrum? We always say that the dam's colostrum is the best colostrum for the calf. However, there are scenarios where feeding an artificial colostrum may be a better option for the calf. These scenarios are when the calf is born and the dam has little to no colostrum, so therefore it would be important to supplement or replace with artificial colostrum to ensure that calf has received all its correct immunoglobulins. If there's concern about disease transfer from the maternal colostrum, this would be a time to consider using an artificial colostrum to reduce that risk of disease being passed on to that young calf. If you have a cow that has twin calves born, there is potentially not sufficient colostrum for the two calves, so this would be another scenario where using an artificial colostrum would work well. If calves are born and it's been a difficult calving, or if it's been a cesarean, for example, these would be scenarios where providing artificial colostrum would be beneficial to give that calf the best start in life. The reason for that is because these calves typically have a prolonged calving period, which because of the difficult birth or the cesarean, so the need for immunoglobulins and good quality immunoglobulins is really important to ensure that their immunity system gets started straight away. When you're mixing your colostrum powder, it's really important to read the label to get the correct instructions for the correct amount of grams of powder to litres of water, and also really important to think about the temperature of that colostrum. So you want it at the body temperature of a cow. So it's really important to make sure you're feeding the correct temperature of water to the correct amount of powder. And it's really important to read the labels of the colostrum powder that you're feeding to ensure that you're getting the correct amount of powder put in, because it does vary between different colostrum powders. The key thing is that colostrum must be fed within the first 2 hours of birth. This ensures that the immunoglobulins are able to pass across the stomach wall into the bloodstream and start that immune system. The absorption of these immunoglobulins does decrease over 24 hours, so that is why it's really important to get that first feed in within the first 2 hours to allow maximum absorption of those immunoglobulins. When looking at labels of artificial colostrum, there are so many different products available on the market now. So it's really important when you're looking at the label that you are seeing bovine colostrum, the full fat, up there as one of the top ingredients in the colostrum powder. Feeding hygiene of colostrum is really important because the first couple of hours of life is when that calf has very low immunity. So when you are feeding colostrum, you should ensure that the teats or the bottles that you are feeding it from have been thoroughly cleaned and are disinfected if possible, so that the calf is getting the cleanest teat available to reduce the risk of disease transfer. The other reason feed hygiene is really important is this allows the maximum amount of immunoglobulins to be passed and transferred into the calf and pass through that stomach wall into the bloodstream. The contamination of feeding equipment can increase the risk of bacteria, which can increase the risk of disease within the young calf. The bacteria can also prevent the absorption of colostrum and immunoglobulins across the gut wall. So again, it's really important to make sure that feeding equipment is nice and clean. So the general rule of thumb for colostrum intake for a calf is 10% of their body weight within the first 2 hours and a further 5% of their body weight within the first 12 hours of birth. So for example, if you've got a 40 kilo calf, they require 4 litres of colostrum within the first 2 hours of birth. If you have incidences of issues with calf disease or mortality, then an option that you can look at is getting your vet out to do a blood sample to check what the immunoglobulin levels are in the calf. If you are going to go down the route of checking immunoglobulins in the blood, then this needs to be done within 7 days of the calves being born to see whether that immunoglobulin levels have transferred as well as they should have done. This is all really important to help ensure those calves get the best immunity, and by providing an artificial colostrum if required because of whether the cow's got little to no colostrum or it's had a difficult calving, it ensures those calves receive the correct amount of immunoglobulins through the passive transfer of the gut lining and into the bloodstream.